Welcome, everyone, to Grand Rounds today. I'm Dr. Brian Isaacson, and I'm happy to introduce Dr. Dan Krizan, who I've been enjoying mentoring during his time here at UNM. Dr. Krizan is a faculty member in the Department of Psychiatry and Behavioral Sciences, and he is a licensed clinical psychologist in the state of New Mexico and a certified mental health performance consultant with the Association of Applied Sports Psychology. Dr. Krizan started with the Lobo Athletics in August 2023 as the Director of Athlete Mental Health and Performance, working directly with UNM student athletes. His areas of expertise include performance enhancement and mental skills training, anxiety, stress, and overwhelm, depression, adjustment, identity development, behavioral or emotional concerns, relational distress, and trauma. In addition, he provides a multicultural diversity perspective while utilizing an integrative therapeutic approach and specializes in the intersectionality of clinical mental health and sports psychology. And he embraces the theory that clinical mental health and psychological performance in sport are not mutually exclusive and can often impact one another. So, Dr. Krizan, take it away.
Thank you, Dr. Isaacson. It's been great having you as a mentor and always appreciate what you do. Super excited to talk to you guys today at Grand Rounds, a little bit about sports psychology and telling you a little bit about, let's see. Now my slides aren't moving.
Are you in presenter mode?
I am in presenter mode. Let me see. Oh, I got it. Okay. Perfect. Okay, so yeah, just super excited to talk to you guys today about sports psychology and really just wanted to go over some of the objectives I'd like to be able to go over with you all. And first and foremost, really just kind of differentiating the different domains within sports psychology. So we'll go over this in a little bit, but essentially there's two main domains, more so one being clinical sports psychology, so what it looks like to work as a clinical psychologist with athletes. And then the other domain being more so that mental performance consultant working on enhancing performance for student athletes. Additionally, I want to be able to detail what those clinical services look like in terms of providing those for student athletes. I'm probably not going to spend so much time on that aspect because that's pretty consistent with the work that we all do. It's not too much different in terms of clinical care for a student athlete or a non-athlete, but there are a few nuances with that athletic population that I will go over. And then additionally going over, and we'll spend a little bit more time in this section because it's probably something that might be a little bit more new or interesting for many of you, is detailing what that performance enhancement kind of area looks like working as a certified mental performance consultant. And then finally, just interviewing how our UNM implementation of sports psychology has looked like here. So how we've been able to integrate both that clinical care and also that mental performance consultant type care for our student athletes. So what is sports psychology? So if we're just going off basic definitions, the science and application of psychological principles to human movement, performance, and well-being in sport, exercise, and other physical activity. It explores how psychological factors affect physical performance and how participation in sport and exercise affects a person's psychological development, health, and well-being, right? But I think, like I was kind of alluding to in the past, it's a little bit more than that. And what we've seen in the actual field of practice of sports psychology is two main domains, one being that clinical sports psychology. So the focus of that is going to be more so the mental health and clinical well-being of the athletes. And this is usually going to be provided by practitioners who are either licensed psychologists or licensed social workers, or anyone generally who has who is licensed as a mental health therapist. On the other side, we have those mental performance consultants, and their focus is more so on helping the athletes enhance their performance and developing skills for optimal functioning. And practitioners for these are going to be called CMPCs, or Certified Mental Performance Consultants. And typically this is going to look like someone who's gone through a master's degree or a doctorate degree in what we would call sports psychology. But usually these are going to be more kinesiology-based degrees, so they would not be licensed therapists, right? So oftentimes what you'll see happen with people who are working in sports psychology is they'll have some form of both of these aspects. So maybe, a master's degree like myself in sports psychology while also getting their doctorate in clinical psychology, or it could be vice versa. Maybe they have a master's degree as a licensed social worker and they have their master's or doctorate in sports psychology, just to ensure that they can do both types of work with the athlete. Right, and just differentiating some of the key roles within both of those domains, right? So in that clinical sports psychology, we're really working more towards that diagnosis, treating mental health disorders, and providing psychotherapy for issues like anxiety, depression, trauma, grief, crisis, providing crisis intervention and managing acute psychological distress. And oftentimes we're integrated into a sports medicine team. So here at UNM, that might look like collaborating with the primary care physician that treats the athletes in their training center, or the athletic trainers or physical therapists, right? So having that multidisciplinary approach with the medical field. And then from the mental performance side, it's more so teaching mental performance skills. So I think a really good way of looking at it is almost like a strength and conditioning coach for the mind of the student athlete. So working on goal setting, imagery, visualization, positive self-talk, how to bounce back or refocus after making a mistake, right? And the role for a CMPC or mental performance consultant is more so working not only with the individual athlete themselves, but there's a lot more team integration. So you might be doing more team workshops, you might be observing practices or games on the field, and just more general communication with the athletic staff in itself, right? And in this work, we're doing more performance work. We're not really working on any of those clinical issues. Obviously, this is for mental performance consultants who do not have a license in therapy. Obviously, if you have both, you're able to kind of work with the athlete wherever they are. So just going over some mental health basics in the college setting. So these first statistics are not for specifically for student athletes, but just for students in general. Approximately 39% of college students will experience some sort of mental health condition. However, in the 1980s, 1 out of 10 college students were in need of mental health resources. Today, that looks more like 1 in 3. So we've seen a big, shift in terms of need for mental health resources over the last several decades. Obviously, there's a lot of things that have accumulated to cause that. I mean, we can look at phone usage, screen time. Obviously, the COVID pandemic over the last 5 or 6 years, we saw a big tick up due to that. But I think also, just as importantly, the reduction of stigma in terms of seeking out mental health resources or needing help, right? Now, more so in terms of with athletics, in 2013, the NCAA Chief Medical Office actually declared mental health as the #1 priority in terms of safety concerns in the NCAA. So we've seen a big push in the last 15 or 20 years from NCAA to make sure that we're really stepping up our game in terms of resources and accessibility of mental health for our student athletes. So although college students are more open than previous generations to seeking help, we see that number is actually a bit lower for student athletes, right? And why is mental health important for student athletes? Well, we see about 33% of all student athletes experience some sort of depression, anxiety, or other mental health concern. And of that 33%, only about 30% are actively seeking services to address it. In 2022, so shortly after COVID, we had 5 NCAA athletes die by suicide within a 2-month span from March to May 2022. And that was really another push from NCAA afterwards to step up resources and provide funding for mental health resources. And then a statistic that I found really interesting was 61% of women's sports participants and 40% of men's sports participants identified mental health as their primary reason for transferring universities, right? So if we look at those statistics combined, it's almost like 50% of athletes who are contemplating transferring have identified mental health reasons as their primary reason for doing so. So this is a study done from the NCAA athlete well-being, and just shows how athletes perceive support within their campus. So this is not a UNM study. This is just NCAA across the board. But I find these statistics pretty interesting and kind of gives us some areas to work towards, right? So I know where to go on campus if I have a mental health concern. Only about 2/3. I know how to help a teammate who's experiencing a mental health issue, about 50%. This next one is one that I feel most alarmed by. I would feel comfortable seeking help from a mental health provider on this campus, less than 50%. Again, reminder, this is not UNM, this is NCAA in general, but it shows you just the general consensus and that stigma that's still there for student athletes, right? My coaches take mental health concerns of their student athletes seriously, right around 50%. My teammates take mental health concerns of their fellow teammates seriously, a little higher for women's sports, 65%, and about 58% for men's. And I feel that our athletes' mental health is a priority of our athletic department, again, right around 50%. So there's obviously not only a need to, you know, address the first issue of knowing where to go, but also within the athletic departments to ensure that athletes feel like mental health is a priority within the athletics department and they do have the support and resources needed. So, what may be some barriers for athletes to seek help, which may be specific to student athletes, right? So, first and foremost, if they don't know where to go or who to see, that can be a significant barrier, right? So, we want to make sure that the athletes do know who they can reach out to and how to make an appropriate referral. Another major factor can just be time. So, being a student is time demanding in itself. And then you add on 2 practices a day, whether that's weights or training or whatever that looks like. It can be really hard to find an hour slot that a student might have that fits with the therapist schedule as well. So, it can be really challenging just to be able to find the time to be able to set up an appointment. Another big area is just the stigma with mental health within athletics. So, for decades, there's kind of been the underlying stigma that you don't talk about your problems. You kind of push through it. You fight through the pain, right? So I think for athletes, it's been difficult to be able to navigate what's the culture of the team? How are my coaches or my teammates viewing mental health? And is it something that they may think of me differently if I were to go to speak to someone, right? And then finally, who will know what I share, right? Like, so there's always that fear of, hey, if I go and speak to someone, is coach going to know, right? So making sure that they're informed in terms of confidentiality and what that all means. So just some common risk factors. These aren't, exclusive to athletes, but if there's any history of ongoing or history of trauma or abuse, ongoing stress or anxiety. This one can be a little bit more related to athletes. So if they're experiencing another illness or injury, so we see this a lot within athletics. If an athlete has, for example, gone through an ACL surgery, they may be out of their sport for a year, right? And that can be a really difficult rehabilitation period for them because a lot of times their sport is such a big aspect of their identity, and maybe it's even one of their main sources of coping, that when that's taken away, it can be really easy to slip into a depressive state or start experiencing some anxiety as they return from injury as well. Any family history, substance or medication side effects, or any big life transitions. So obviously, going to university in itself can be a big life transition. For athletes in particular, we get a lot of international students. So not only moving away from a different state, but it could be moving away from a different country entirely and not being having English as being your primary language, right? And then more recently, and if we have time, we'll talk a little bit about this at the end with the whole NIL deal that's been happening in college athletics. A lot of young kids coming into a lot of big amounts of money for playing sports in college, especially in basketball and football. And how might that affect, their ability to handle being a student athlete? And just some signs and symptoms that, not only that we look out for, but, that we really convey for our athletic trainers, coaches, and academic advisors, just to give them some insight as to what to look for in terms of how their athletes are doing. So if we're noticing, multiple areas of these symptoms across the board, whether it's physical behaviors or thoughts, making sure that we're just being aware of that and making the appropriate referral when necessary. Okay, so what are the possible reasons student athletes may seek out mental health resources for clinical concerns? So, obviously that's going to look like if they're dealing with anxiety or depression, or maybe they're experiencing some disordered eating concerns, or if they've gone through a trauma, abuse, or a sexual assault, or crisis intervention, right? So this is not unique to student athletes. So I'm not going to spend a whole lot of time on this section here, but I did want to really highlight two areas that I do feel like are kind of unique for student athletes, being those last two. So returning from injury and transitioning away from sport. So in terms of returning from injury, and maybe we'll just use an example, like in this picture, if a soccer player had torn their ACL, right? So obviously, we want to be able to address the psychological impact of that injury, kind of normalize the emotional responses that they may be having, helping the athlete process common reactions like grief, anger, frustration, and validating that these feelings are a normal part of their experience, and mitigating mental health risks. So, actively working to prevent or treat clinical issues such as depression, anxiety, or any adjustment disorders that might stem from that injury. Right? We also want to help facilitate adherence to rehabilitation. So using goal setting techniques, kind of breaking down that long rehab process into short attainable goals. So for an ACL injury, a lot of times that's a 9 to 12 month rehabilitation process just to get back and playing. And that can feel really, really overwhelming. And there's a lot of uncertainty for that athlete who's going through that, right? They may not know what are things going to look like 2 months from now. How is my leg going to be doing? How are things going to be looking 6 months from now? And when it comes to 9 and 12 months from now, am I going to be able to play? Or if I am able to play, am I going to be able to have the same sort of success that I had previously? Right. So they oftentimes go through a lot of those questions. There's a lot of uncertainty. And I like to use the metaphor of hiking or climbing a mountain, right? And it's very convenient that we have the Sandias here. So you can kind of just imagine if you were at the base of the Sandia Mountains and you looked at the very top, it looks insurmountable. It looks like that's really far away. How am I supposed to ever get all the way up there? Right. But if I look 200 meters up on towards that hill, I see a tree. I know I can get to that tree. Let me just focus on getting to that tree. And we make our way up into that tree. From that tree, we see a boulder another 200 meters up on that path. I know I can get to that boulder. Let me just focus on getting to that boulder. And we continue that process, right? So we use that mindset until we eventually get to where we want to go. And I think when we're dealing with injury, it can be a similar situation where if we're looking at the whole time period, it can be really overwhelming. But what does it look like for me to focus on what's in front of me today? How do I put my time, energy, and attention into what I have to do today the best that I can? And then in terms of managing return to sport anxiety, so helping them rebuild confidence in their injured body part. So, using visualization or other mental skills to help the athlete trust their body again and reduce any fear of re-injury. And then finally, maintaining that athletic identity and connection, right? So making sure that, they have strategies for that athlete to stay engaged with the team, that they're not isolating themselves from practices, and maybe seeing if there's different roles within the team that they can adopt during that rehabilitation process, whether that's helping coach with stats or being one of the bigger cheerleaders on the sidelines, whatever that looks like, making sure that they still feel like they have a place within that team. And then outside of that, making sure that we're developing our identity outside of being an athlete, right? Because so many times these student athletes have made their whole identity being their sport or whatever their athletics is, that when that sport's taken away from them, it can be a really, really difficult time, right? So we want to work on how do I find other areas of my life or my identity that are important to me? how do I, navigate the other part of being a student athlete, the student part, and make that maybe a focus? Or how do I put more time, energy, and attention into the relationships that are important to me? Or even how do I put more time, energy, and attention into finding outside interests or activities or hobbies that I may enjoy? Right. So I always like to tell our athletes this is really a good opportunity when we have that injury to develop these outside interests and these other elements of our identity, because our sport's not always going to be there. And that transitions kind of into that next piece of what it looks like working with an athlete who may be transitioning away from sport, whether that's through retiring or graduating, or if they have a medical red shirt where they begin injured and they cannot no longer play. So that same kind of concept, helping that athlete kind of facilitate that identity exploration, helping them figure out what's important to me outside of my sport and how do I put the same kind of time, discipline, and energy that I put in my sport into these other areas of my life. Right? Obviously, when I help them process any grief or loss, of providing support and space to process the complex emotions associated with the end of an athletic career, and normalizing that those feelings are common and valid to a major life transition. Right. And then we also want to make sure that these athletes have a plan B. So I see this a lot of times, particularly in football, which is interesting in itself. But you guys can look over these statistics, but it's really interesting, right? So there's over 1 million high school football players. There's about 70,000 NCAA football players. Of those 70,000 NCAA football players, only about 300 will make it to an NFL team for their rookie season, right? So the percentage of players from NCAA to NFL is about 1.6%. But when working with a lot of these athletes, the vast majority of them will tell you that their goal is to make it to the NFL. And a lot of them don't have a backup goal, and they haven't supported themselves with a major or a focus in academics that can help be a plan B for themselves. A lot of times they're taking liberal arts majors just to take classes to remain eligible, right? And then what happens is they don't get drafted, and then it almost feels like all that school was for nothing. So what we want to do is really early on, so freshman, sophomore year, when we're working with these athletes, really encouraging them to look at what are other aspects of who they are and what could they see themselves doing outside of playing their sport professionally that they could be interested in, right? And helping them know that this is likely what you will be doing, even if we just, break out the sheet and look at statistics. This is very likely, what you'll be doing for the next 30 years. So why don't we focus on that? We'll still have the big outcome goal of making it to professional sport, but at least you have something that's a bit more secure and you can utilize the resources that you have at the university while you're here. Because if you're going to be taking classes anyways, you might as well take it for something that you're interested in and something that can provide a future for yourself. Okay, so I also wanted to make sure that we take some time to talk about what are more so the mental performance kind of skills. So this is kind of the not so much the clinical work, but more so how do we help athletes improve in terms of their performances. So athletes who are seeking out a mental performance consultant, they might be looking on trying to improve their confidence or reduce performance anxiety or get a better hold of how they're talking to themselves, like using positive self-talk, or even how to deal with difficult relationships with coaches or teammates, right? So I'm not going to be able to go through all those, but I did want to be able to make sure that we got a chance to touch on some of the main areas that I do work with our student athletes. So performance anxiety is probably the number one performance related goal that we'll work on. But we also do visualization and guided imagery. I work with a lot of athletes on using reset skills after making a mistake and experiencing a lot of rumination in the game setting. How do I bring that focus back to the present moment and reset, right? Goal setting is always a big one, right? So how do we take big outcome goals and break them down into achievable process related goals? And then lastly, how are we talking to ourselves and how are we perceiving our performances and experiences? So we'll start with the performance anxiety piece. And essentially, what is performance anxiety? And it's anxiety that people experience in anticipation of and or during important tasks. And that performance is often impaired by increased arousal levels, leading to increased cognitive and physiological symptoms of anxiety. Now, what causes that performance anxiety? And I like to say it's kind of a combination of three different things. One, our cognition, how are we thinking about that upcoming event? Two, our emotions, how are we feeling about that upcoming performance? And three, that physiology. How is our body feeling or reacting to that upcoming performance? What are the specific bodily sensations that we're experiencing? So one way that we can kind of work with athletes on reducing performance anxiety is kind of targeting those physiological symptoms, right? And one thing that happens when we start to feel anxious, whether we know it or not, is we start to hyperventilate. When we have that really short, choppy respiration rate, causes the heart rate to go up. Heart rate goes up, all those other physiological symptoms of anxiety may start to increase. We might start feeling nauseous. We might get butterflies. We might start getting sweaty palms. We might start shaking or trembling. And all those things are really difficult to control. The one thing we can control physiologically is our breath. So if we slow down that respiration rate to causes that heart rate to go down. And that heart rate goes down, those other physiological symptoms of anxiety are going to decrease as well. When our body's in a more calm place, it's easier to bring our mind into a more calm place. If our body's in a very elevated place, it's really difficult to think through situations clearly. Now, we talked a little bit about how we can address the physiological piece, but let's also look at the cognitive piece, right? So something that's pretty interesting is athletes who report feeling nervous or anxious before a big game might report the most common symptoms as rapid heart rate, stomach butterflies, sweaty palms. Maybe they're experiencing some racing thoughts about the future event, right? So these are some of the more common reported symptoms. Similarly, athletes who report feeling really excited before a big competition or game, and maybe you guys can think about this too, is quite similar, right? So you will still have that rapid heart rate or those stomach butterflies or those sweaty palms and even those racing thoughts about the future event. So even though they feel quite different emotionally, physiologically, there's quite a big overlap in terms of what we experience, right? So what's really the difference here? And one can argue it's how we're interpreting what we're feeling. What we tell ourselves impacts our thoughts about that performance. So if I'm getting stomach butterflies, I got that rapid heart, I got the sweaty palms, and I tell myself, oh shoot, I'm feeling this way because I'm nervous, where do my thoughts tend to go after that? What if I choke? What if I mess up? What if coach benches me? I don't want to let anyone down, right? A lot of what ifs, a lot of doubt, right? When we start to experience those what ifs and that doubt, we become hesitant, we get tight, and we kind of avoid. We don't really want to do that upcoming performance or competition, right? Inversely, what happens when we're feeling that heart rate, those stomach butterflies, those sweaty palms, and we're telling ourselves, I'm feeling that way because I'm excited? How does that change where our thoughts go from there? Maybe it turns into, I get an opportunity to do what I love today, or I'm excited to have the opportunity to get a personal best or to win this game, right? So just by having that kind of shift in that perception of how we're feeling can have a big impact in terms of where our cognition leads and then emotionally how we feel, right? Even our body language changes when we start to view things as an opportunity and we're excited. We might have our more up straight posture, our muscles might be more relaxed, and in sport, fast muscles, a long, relaxed muscle. So trying to use our physiology in our own favor. When we interpret our physiology as excited, we're directing our cognition to approach the event in a mindset that encompasses opportunity and confidence. When we interpret our physiology as nervous or anxious, we direct our cognition to a mindset of fear and hesitancy. Right? So we want to try to use those breathing skills, but then also use our cognitive skills of I'm feeling this way because I'm excited, and then listing out the reasons why we're excited. Because I guarantee you, the vast majority of these people are excited about that upcoming event. Like, this is the sport they love. They put a lot of work and effort to it. It's a big game. It makes sense that you're excited. So really just reminding yourself of that. What's in our control? So how are we perceiving the performance or the demand? Our thought about our feelings towards the performance impacts how we view it. And then our physiology, utilizing our breath and other relaxation techniques to reduce that physiological symptom of high arousal. And if you can do both those things, you'll help to reduce those symptoms of performance anxiety. And I always tell our athletes too, like, it's okay if we're feeling nervous or anxious. We're gonna feel a bit nervous or anxious, and that's totally okay, right? It's our body's way of saying we're getting ready to deal with this event. But we also have these added skills that can help reduce some of that anxiety if we feel like it's starting to get to the point of being overwhelmed. Okay, and then one of the next skills that I really like to go over is visualization and guided imagery. And the way that we do this is typically first by starting out with doing some of the box breathing skills with the athletes, getting them in a comfortable position, whether that's sitting or laying down, and really getting in touch with their breath. I'll typically put on some meditative music, just kind of having that relaxing atmosphere. And then we'll take about 5 to 10 minutes just to do some muscle relaxation, some PMR, just to get the body into a very calm state. And then I'll create for each athlete or team, if it's either a team workshop or if it's for a specific athlete, I'll have a script made out for them for their specific sport to take them through some guided imagery, right? And on the right-hand side, you'll see just an example of one of the scripts that I had. I actually used this with women's softball earlier this week. So that was a lot of fun going down to the softball field and having them all lay out on the field and taking them through a guided imagery. So you guys can read that as I continue to go on if you'd like. But what we want to do is typically after that progressive muscle relaxation, start off by just having some positive affirmations and then highlighting past successful performances. So kind of using your mind as like a highlight reel of when you were performing at your best. And then transitioning those performances to envisioning what's it going to look like for you being your best in this next upcoming performance and trying to get in touch with as many of those senses as possible. So, hearing the chatter of your teammates or the hum of the crowd or feeling the crunch of the dirt or the grass beneath your feet or feeling the sunlight touch your skin when you get out of the dugout, whatever that is, trying to make those senses as real as possible so that when you are out there in your next competition, it feels like you've already been there before. And just some key areas as to why visualization guided imagery can be so helpful. And one, it enhances that motor performance and skill acquisition. So neurological studies show that mentally rehearsing a skill activates the same brain regions, primary, more context, cerebellum, basal ganglia, as physically performing it. So strengthening those neural pathways without actually doing the physical movements. Even early research using EMGs demonstrated that when individuals vividly imagine performing a specific movement, low-level subliminal electrical activity is recorded in the very muscles that would be used for that actual physical movement. So they're not actually contracting, but there is some like micro-firing going on at those points. It can also help build confidence and self-efficacy. So visualizing oneself performing successfully creates a mental blueprint for achievement. So it's almost like I've been there before, I've done this before, I've overcome these things before, right? And then finally, improving concentration and focus. So just by utilizing imagery, it requires us and trains us the ability to control and direct our attention, right? So we have to learn how to slow down first and foremost, slow down our breath. We use that progressive muscle relaxation to slow our body down, right? And then with guided imagery, a lot of times we have to redirect our attention back to the task at hand because it's so easy for our mind to wander. So it is a practice of being able to bring our attention and concentration back to where we want to be at that moment. And if you guys have not seen Cool Runnings, that's the picture on the bottom. I highly recommend it. One of my favorite sports movies. And here they are practicing some visualization. They're bobsledders in a bathtub. Okay. Another skill that I really like to go over is the reset technique. We do this a lot with sports that are stop and go. So tennis, football, softball, baseball, golf, times where there's going to be a break in between play where you can take 10 to 20 seconds to utilize this skill. So this is not so much going to be used in like swimming or running or even soccer, right? But more so in those sports where there is a break in play. And essentially what we're working on here is after making a mistake, right? Sometimes it's really easy to get caught up in that mistake and get upset at ourselves and replay that mistake in our mind. And we're no longer performing well because our thoughts are no longer in the present moment. They're back at that previous mistake. So the purpose of this reset technique is essentially, how do I bring my attention back to the here and now, right? So there's four main steps that we want to work on. And first and foremost is going to be quickly analyzing what was the mistake I made and what do I do differently next time. Now, we're not spending 2 minutes doing this. It's going to be 2 to 3 seconds. These athletes are elite. They know what they did wrong and they know what they have to change. So maybe it was like in tennis, I didn't follow through with my hips. Next time I got to make sure I follow through. Super simple, right? Step 2, just taking one deep breath. We're not doing 6 rounds of box breathing, but just one deep breath to help get that heart rate down just a little bit. Right? Calming down the body just for a little bit. Step 3, combining a physical action with a positive affirmation that we tell ourselves. So that may look like fixing our hat and saying, I got this, or clapping our hands and saying, next point, or slapping our leg and saying, I can do it. Whatever it is, when I combine that physical action with that phrase that I tell myself, that's my cue that I'm now back in the present moment. I'm back in the here and now. And then for step 4, putting my attention where it needs to be, whether that's on the opponent or the ball or wherever that is, making sure I'm placing my attention on where it should be at this time. So what we're doing by using this reset technique is we're not allowing ourselves to ruminate on the mistake that we made. And we're also not allowing ourselves to dwell on it. We're saying, here's what happened. Here's what I do next time. I'm going to reset, bring myself back to the present moment, and I'm going to focus on the next thing. Okay. Another big thing that we talk about with our student athletes is goal setting. So, I think a lot of times athletes come in with big outcome goals that they want to reach, and that's always great. But really helping athletes kind of navigate goal setting and making sure that they're, using SMART goals, so they're specific, measurable, making sure they're achievable as well is going to be big too. And one of the main things that we want to do is help them focus on what they can control. They can't control if they're going to win a 100-meter dash race, right? If you just have someone that next to you hits a world record, like what can you do, right? So focusing on the aspects that are within your control. What parts of your race do you want to work on that you can improve on? One big area that I really like to focus on is highlighting our areas of improvement versus our strengths. And I think as athletes, and maybe just as humans in general, we so oftentimes feel comfortable focusing on what our strengths are and shying away from where our areas of improvement are, right? But what happens is if we put the majority of our time, energy, and attention into what our strengths are, there's very little room for growth, right? Because we're already really progressed at that area. However, if we put most of our time, energy, and attention into what our areas of improvement are, that room for growth is much bigger. So when I do goal setting, I really like to first target like what are our areas of improvement in your performances, and how do we target that with some process related goals. And one way I've been able to kind of check in with athletes in terms of working on some of those goals and making them consistently part of their work is to create this kind of like daily journal / goal setting exercise that I'm working into kind of making for all the athletic teams next year. So it has 4 categories, and first is going to be really figuring out what are the top goals for today. This is something that we'd like to do primarily in the morning before they have their practices or their classes, and just kind of setting out what are the 3, 4, 5 things that I really want to put some time, energy, and attention for today. It doesn't have to be all performance related. It can be about making sure I study for an exam or whatever that looks like. Number 2, and this is going to be 2 through 4, are going to be after the day is kind of already started to wind down. So after practices and classes, just kind of being grateful, right? So writing down 2 to 3 things that we're grateful for and helping build that positive mindset and resilience and reminding ourselves what we're thankful for. And then number 3, I think this one's super important, is making sure that we are acknowledging and recognizing what we're doing well and what we're improving on. It's so easy for athletes just to focus on what they didn't do well and where they messed up, that a lot of times they neglect what did I do well and where did I improve. So being really intentional and reminding ourselves where we're making progress, right? And that's going to help build their confidence. And then 4, kind of reframing that area of mistakes, right? So if we do mess up, if we do fail, how do we reframe that into this is an area of growth, right? Like how can I learn or improve on what went wrong today? And maybe how does that become a goal for tomorrow to work on? Okay, this will probably be the last performance kind of skill that we go over, but this is going to be much more similar to just basic CBT, right? So what are we telling ourselves and how does that impact our performance, right? So within CBT, we know how we talk to ourselves or what we think affects how we feel affects what we do. Right? And in sport, that's going to look really similar, right? How we talk to ourselves affects how we feel is going to affect what we do, and that kind of translates to performance, right? So a big part of the work too is just kind of using some cognitive restructuring tools if athletes are really hard on themselves, if they are being overly negative, or if they're really only focusing on their mistakes, to be really more objective in how they're viewing their performances, right? To at least use neutral to positive self-talk in order to build that confidence. And making sure that we're reflecting on things objectively, right? So if they went through a practice or a game and, maybe they had 9 great passes and they had 1 horrible pass, and they hyper-focus on that 1 horrible pass, and that's all they think about, they're going to start telling themselves or thinking about themselves that they're a horrible passer, right? But if we look at it more objectively, hey, you got 9 out of 10 passes pretty well there. I think let's see how we can reframe that a little bit, right? And see if that affects how you feel in terms of your confidence. I'm not going to do the vignette because I'm not sure if we'll have time for it today. And I wanted to spend the last 10 minutes before questions, just kind of, 7 minutes, sorry. 7 minutes before questions, just kind of going over how we've been able to implement some of these resources here at UNM. So here are the beautiful faces of our team here at UNM as our behavioral health team for athletics. We have myself, Dr. Altschul, Dr. Waldorf, Dr. Lardier, Dr. Sauer, and Dr. Pence. And I'm just going to spend a little bit of time just kind of sharing how we work with our student athletes and in which capacity. So in terms of providing clinical services, we have myself, Dr. Altschul, and Dr. Lardier, and Dr. Waldorf, who are licensed therapists and psychologists who work to diagnose and treat mental health disorders. So we're working with student athletes who may be struggling with depression, anxiety, disordered eating, substance abuse. We have a substance abuse program that we have a 16-week substance abuse program that we work with our student athletes as well. We also provide psychotherapy for issues like trauma, grief, and identity crisis, crisis intervention, managing acute psychological distress, and so on. We also work as a holistic team, so we meet once a month, also with Dr. Sauer and Dr. Pence, and then a few people from the athletic administration. So the head athletic trainer, the director of academic advising, and the director of compliance, kind of just to make sure that everyone's on the same page and just to bring up any cases that are going to be needed for a multidisciplinary team. And then in terms of psychiatric services and providers, we have Dr. Sauer and Dr. Pence. So not only do they provide psychotherapy and diagnose and treat mental health disorders, but really importantly for us, as physicians, they're uniquely qualified to prescribe and manage psychiatric medications. And they understand how these medications can help or affect athletic performance and how they interfere with supplements and may impact factors like weight, energy levels, and recovery. And then finally, for that mental performance piece, so I work as the mental performance consultant here at UNM as well. So working with athletes and teams in terms of those mental skills that we talked about. So like the visualization, goal setting, performance anxiety, self-talk, those reset skills. And like I talked about before, one of the things unique about that is it's going to be a lot more team-oriented than just individually oriented. One thing that I have noticed that's been really helpful about having both of these kind of fields as resources is a lot of times that sports psychology piece or that mental performance piece can be the foot in the door for the athlete. So they may not be feeling comfortable in terms of the stigma, whether that's the culture of the team or whatever that is, to go to therapy. But, when they hear about, oh, we have sports psychology services as well, sometimes that makes it easier for them to come in and kind of put their foot in the door. And then after a session or two, once they're comfortable, it might turn into, hey, can I actually talk to you about this? And of course, that's what this space is for. So just talking to you a little bit about what our referral process looks like. We don't have a specific one-way referral process. It's kind of a spider web in a sense, but at the beginning of every year, I'll talk to each and every team with their coaches there and all the athletes, and I'll give them my information, our team's information, tell them about all the resources that we have for them and how they can get in touch with us. So the athletes themselves always have a way that they can directly reach out to us. Athletic trainers are huge for us. They're with the athletes almost 24/7. They're with them at every practice, at every game, at every bus ride, every plane ride. They travel with them nonstop. So they're actually really, really close with the athletes. And a lot of times they're quite similar in age even. So a lot of times the athlete's first person they go to tell if they are struggling is going to be their athletic trainer. So we do get a significant amount of referrals through our athletic trainers. We also may get some from coaches, academic advisors, or their primary care physicians down in athletics. After they do like physicals, they'll do like a GAD-7 and a PHQ-9. So if they pop on those, we'll sometimes get referrals that way as well. Okay, I'm going to kind of hurry up a little bit because I know we only got a couple of minutes left before questions, but in that referral process, essentially I'll meet with all the athletic trainers and all the academic advisors and coaching staff as well, just to provide psychoeducation in terms of when to make those referrals to our student athletes and how to make those referrals as well, things to look for, how to ask some of those tough questions. And we kind of created a stoplight in terms of a referral method. So if the athlete just wants to work on, mental performance skills, or they have some mild clinical concerns, we'd call that a green, and we'd have that person, whether it's the athletic trainer, the academic advisor, or whoever they were referred to, make that referral to myself and the head athletic trainer, and we'll get them seen typically within a week or two. If it's a yellow, so if maybe that trainer noticed some self-harm like marks, like some cuts, or maybe they noticed some significant multiple behavioral changes, like isolating more than usual, being more emotional at practice, or they're just overall just generally concerned, we'll call that a yellow, and we'll have that trainer reach out directly to myself and the head athletic trainer, and we usually will get those in within a day or two. And then obviously if it's an imminent crisis, that trainer is concerned that athlete is going to harm themselves or someone else, we ask them just to call 911 first, get everyone into a safe situation, and then refer to us, and we'll make sure that that person gets all the resources they need as quickly as possible. And then in conclusion, mental health and sport performance are not necessarily mutually exclusive. So what this means is, obviously if an athlete is not performing well, like with their competitions and they're struggling, it might affect their mental health, and vice versa. If they're not feeling well mentally, they're probably not going to be performing at their best, right? So I think it's really important that we have both of these resources available for our student athletes, because a lot of times the work is a little bit more fluid between those domains. And these are skills that go beyond just athletics. Maybe in your work you have performers or musicians, or maybe even like politicians or people that do public speaking events, right? So I think all those mental performance skills that we discussed are really easily translated to other performance areas as well. And then finally, I know we don't really have time to discuss these too much, but just some future considerations. How may the NIL change the landscape of supporting athletes in the university setting in the future? And how are ways here at UNM that we can optimize our services with maybe less funding than what a Power Four school may have? So, schools within the Big Ten or the SEC, a lot of times they have 4 to 5 full-time sports psychologists, meaning one sports psychologist works with 3 teams, another one works with another 3 teams, and so on. So we have to do a little bit more with less. And I think we do a absolutely phenomenal job with the clinical aspect. Like, the team that we have is amazing. We don't have any wait list or anything like that. They get psychiatric support, psychotherapy support super quickly, and we have very, very talented clinicians. So I think the one piece that we'd like to work on moving forward is how do we have more time available for those mental performance skills for maybe some of the teams that are requesting. Okay, and I'll end right at 1:51.
All right, thanks, Dan. This is a good time for anyone to ask any questions. We really appreciate your presentation, and it's exciting to have this program here at the university. We're honored to have you here and see all the great work you're doing. So thank you.
Thank you.
Thank you for the kind words, Dr. Krizan, for your fellow athletic teammates here. I just wanted to reiterate some of your commentary on the fact that this has applicability outside of athletics. I have a colleague that I was actually in graduate school with who has a daughter who recently got her degree in clinical psychology, and her whole focus is on working with professional dancers. So she's been hired by a national ballet troupe in Great Britain, but talks about the exact same things that we're really talking about here.
That's awesome. Super interesting. Yeah, and it sounds like a performance psychology field too. So yeah, a lot of those skills are translatable, and it's a fun field for sure.
Dr. Delmore has a question. This was such a great talk. Thanks for your reviewing the practical skills. Are you able to put back the slide put up the slide on the self-talk? She was hoping to see that again. And while you're doing that, Dr. Earl has a question.
Yes, absolutely.
Hi, Dave Earl here from psychiatry and then also sleep medicine. Sorry, I've been kind of in and out of the presentation today because of some clinical needs, but I have an interest in this area, and I've given national presentations about sleep in athletes before, which I believe is profoundly important. I just wanted to thank you for taking time to speak with us today and inform us of what you're doing, and just also to reiterate the importance of getting adequate sleep and at the right times for a particular athlete's circadian time, and how important that can be in not only athletic performance and injury risk, but also mood and other areas as well. Once again, thank you for speaking to us.
Thank you, Dr. Earl. Yeah, absolutely. And I'll usually talk with our athletes too that, we can't build on any of those skills that we talked about unless the foundation is set. And the number one foundation for me is always sleep. We have our sleep, we have our nutrition, we have exercise. I usually don't have to worry about exercise with the athletes because they're exercising a lot, but then social connection as well, right? So if those 4 areas aren't met, it's going to be really hard to kind of build on top of that foundation. So yeah, I appreciate those words, and it's definitely something that we we discuss with our athletes as well, and super important too. Dr. Delmore, I'm not sure which slide maybe in terms of self-talk, were you looking at the vignette?
We've talked a lot about building up the program and getting trainees involved. Can you speak a little bit about what your vision for that with getting trainees involved?
Yeah, absolutely. So it's kind of been my hope from early on to get a postdoc for sports psychology. I think either a postdoc or an intern would be really, really something that would be exciting, and not only to be able to have assistance in doing some of the mental performance skills, but just also having the opportunity to create a training program here specifically for sports psychology at UNM. So it's something that, is still in the works, unfortunately, with budgeting from athletics. We've had 4 ADs in the past 3 years. So it's been really hard to find some consistency there, but I think we finally found one that's going to be consistent. So hopefully that's something that we can make some moves within the next couple of years.
Any other questions or comments from folks?
Curious, coming from one of the PGY2s here, wondering if there's any other just like specific certifications or things you'd recommend from like a psychiatry standpoint if we wanted to do more sports psych down the road.
That's a great question. I think the field of sports psychiatry has been gaining more and more traction more recently. Like sports psychology had a pretty big boom around 10 or 15 years ago, and I'm seeing more and more like sports psychiatry starting to kind of follow suit as well. I'm not sure of any specific qualification for psychiatry, but I would imagine if you are a psychiatrist and you go on and get your CMPC, which sometimes is like 2 years minimum in terms of schooling and education and hours of supervision, things like that, you would be in a really, really strong position in terms of finding some sports psychiatry opportunities, because that field's growing pretty quickly as well.
Thank you so much.
You're welcome.
Well, unless there's any more questions, Dan, we'd like to thank you for your time, and I'm sure people could reach out to you with questions or ideas about how they could get involved potentially.
Absolutely. Yeah. My email here.
Thank you, Dr. Krizan, for coming in and presenting for us today. Your time and your effort is greatly appreciated here at the department.
Appreciate that. Thank you, everyone.
Looks like Dr. Varela, did you have a question, or is that a hand clap?
That was me trying to clap.
Okay.
And not knowing how.
All right. Thanks, everyone.